What does ONJ stand for?
ONJ stands for osteonecrosis of the jaw. It happens when, because the way these medications act, over time, the osteoclasts, which are so for bone remodeling, we need two kinds of cells, osteoblasts and osteoclasts. So the osteoblasts are forming bone, osteoclasts are destroying bone, and this constant turnover is important to maintain healthy bone. To maintain healthy bones. So the bisphosphonates act by just inhibiting the osteoclasts, which causes this imbalance, which results eventually in, because these bones are not constantly turning over the way they're supposed to be, they can outstrip their blood supply, and you can have like avascular necrosis, which basically means that the bone is not healthy anymore. It's not receiving those good, healthy blood supplies, which makes them prone to bone overgrowths, and to just necrotic bone, and therefore just non-healing chronic bone problems. And that's called osteonecrosis of the jaw.
What are symptoms that might let a patient know they may be developing ONJ?
If you have like a persistent, like an ache or a pain, or sometimes a swelling, sometimes you can feel a protruding, maybe bone or something in your mouth that shouldn't be there, things like that. So a lot of these non-healing sore or wound or something in that nature generally happens around the face area, in the jaw, and the maxilla, in those bones, the upper jaw, the lower jaw. And so that's why it's really important to have the dentist look at it. But those are some of the common things that people experience.
How is ONJ treated?
So the treatment depends very much on the stage, how bad it is. If it's something simple in earlier stages of osteonecrosis, it's good oral hygiene, mouthwashes, keeping the area clean, antibiotics if there is a chronic infection. Sometimes you may need a prolonged course of antibiotics. Sometimes limited resections. Let's say there's a part that just needs to be taken out, small areas, and the dentist and the oral surgeon will decide how invasive this needs to be. More extensive surgery is generally not preferred, because then can just cause this vicious cycle of creating more issues from bones that are just not healing.